Hello everyone, I'm Ryan. I'm going to be showing you how I do my testosterone intramuscular injection in my right leg today. I've been doing testosterone since I was 13, so it's been 23 years of my life. I was born with a genetic condition called Klinefelter syndrome where my body doesn't make testosterone or makes very little, and so I've had to use artificial methods of testosterone. The intramuscular injection has been the go-to thing for me pretty much my whole life. So medical disclaimer, I'm not a doctor, so please, if you have any questions or you're trying to learn how to do this on your own, make sure you're consulting with your doctor, and that's about it. So what I start out with is, I start out with a 3 ml syringe, which is this puppy right here. And so what I do is I open this up. Throughout the years, I've learned different things about different needle sizes that I did not know as a kid, starting to do my injections at 19. So this pink thing right here is an 18 gauge needle, and I will open this up for all of you to show you how big the hole is. That right there is an 18 gauge needle. That thing is so thick, and this is only to be used for me to draw the testosterone up out of the bottle into the syringe, and then I switch needles. So I've used to use a 23 gauge needle, which is right here, and that's the color. I use a 1-inch 21 gauge needle to draw up my testosterone now, and it comes on the syringe. This is what I've asked for from my doctors. They prescribe it to me, and then I make sure that the pharmacy fills exactly what I want. And then I also use to inject, I use a 25 gauge needle. This is the syringe and the needle, but my pharmacy cannot get me just the needle. So a little bit about testosterone. This is a 10 ml vial, and this little thing right here is a 1 ml vial. It fluctuates between pharmacy, what you can get and what you can't get. I try my hardest to get the 10 ml because I travel a ton and it's just part of my life. It makes my life easier not having to go to the pharmacy and all of that aspect. So I'll just unwrap my syringes and my needles. I've got a Band-Aid. I've got a trusty little auto-injector, and I've got some gauze that's sterile for after the injection. Alright, what I forgot is alcohol. So alcohol is probably the most important thing. It's what I clean the top of the bottle with that can get dirty. So I make sure that that is nice and clean. And then what I also do is I usually open another alcohol swab, and this is what sterilizes your leg. I shave a spot on my leg because I have pretty hairy legs, and I'm able to know like the general area of where I need to do my injection. So that's clean. The next most important thing I'd say is, if you're doing injection for this long, is let the alcohol just dry. Don't blow on it, don't wave on it, just let it sit, let it dry. I take my right hand, I put it in my hip, I put it to there, and then I take my hand from my knee and I put it there. And that area that I shaved is the area that I can do my injection. I'll flex my quad and I'll look at it right here. This is where my muscle is. I'll also scan, like if the light's good, I'll scan for blood vessels to avoid the area of nicking a blood vessel when I go into my leg so it doesn't bleed so much. So right now what we'll do is I take the cap off my 21 gauge needle, I pull it to the area that I fill it up with air, and I do a really small amount of testosterone. I do my injections weekly. Take the bottle, put it sideways, and I just poke it in, push the air in, and then I look at the vial and I pull back. So using an 18 gauge needle, it pokes a hole in the rubber and it tends to make the hole bigger on the rubber, and bacteria and stuff can get into the bottle. So I found using a 21 gauge needle with the amount of testosterone that I draw up is like the perfect needle. So there's that. Then what I do is I make sure that I pull out the rest of the testosterone out of just the little needle tip. Got to be really careful with capping the needle back. Pull it off, and then I take my 25 gauge needle and I put it on my 3 ml. And that's that. What I do is, since I'm ready to go here, pull it off, and you got to get all the air out of the syringe, making sure that there's no air bubbles in the syringe. I push the testosterone up to where I see just a little bead of it come out, and I pull back just a slight. So that right there is ready to go. Since I'm using an auto-injector today, I'm going to recap my needle. And this thing right here has been a lifesaver. After doing injections for 23 years, I get needle anxiety every now and then, and I've had so many different variables of injections that bleed, that hit the nerve, just other aspects of my life, and this thing has really saved me in those crucial moments of filling my testosterone up and then having it sit throughout the day or not wanting to do my injection until like 3 or 4 days later. So this just like cocks back like a gun in a way. It's got a safety on it. It's got a trigger, which is a button. This is a needle guard that kind of like prevents you from seeing the needle go into your leg. It's either on or off. I'll take it off today just so I can show more of what's going on. So there's a little lip here, and this thing just pops in, and it's ready to go. Make sure it's up. Make sure everything's ready. What I do is I just shoot it down to take the needle off, and then I pull it back, and it's locked, it's ready to go. So what I just did notice, right, is sometimes there will be like a tiny little air bubble, and I'm like a perfectionist when it comes to this. So I just want to make sure that everything is perfect, that there's no air or anything like that. So that's ready. My leg's ready. I've got my gauze, which is here. I will set this down on my leg. It's cocked back. It's not going to go anywhere. I just want to make sure that I'm ready on every aspect. When you do your injection, it's best to have all of your supplies and everything in one place. So the least amount of time that you have to think about it, the less needle anxiety you're going to get. So I'm going to stop talking and I'm just going to do my injection. It's been a while since I've done a leg injection, so it might take me a little bit of time. I've got everything. So I'm going to try to just relax my leg the best I can. Okay. I see a little bit of a blood vessel. Alright, ready? So 3, 2, 1. Go. Didn't feel it? Okay, I'm going to aspirate. I'm pulling the syringe back to make sure there's no air or no blood vessel, which it's harder to do in a 25 gauge needle. Okay, there's none. So I just slowly press the testosterone into my body. Done. Pull up. No blood. Gauze. I'm going to rub it a little bit because that's just how I roll. Find the spot. Band-Aid, and that's it. That's done. So that's a weekly thing, part of my life that I've been doing since I was 13 years old, and I hope this video just shows all of you out there about what it's like for someone living with Klinefelter syndrome, that their body doesn't make testosterone, that this is part of something that I have to have in order to live a good life and have energy, muscle, try to build muscle mass, cognitive ability. So I'm just sharp at all the times, and it gives me energy and it gives me life. So hopefully this was informative, and have a great day. We'll talk to you all soon.